These are the two cases which I feel, apart from there are many cases, but I think these are the two cases which make me satisfied about the surgeries.
Thank you, sir. Sir, we are really grateful to have such doctors in our world. So moving to our next question, so describe a time when you faced a stressful situation and how you dealt with it.
Yeah, that's a good question. I think every doctor, not only orthopedic surgeon, goes through that kind of a phase. Means whenever there is we all know that all disease condition, they have do have a complications rate.
Right.
So through you, I want to just convey to all the audience that any disease element do have a complication. Okay, and it has been very in research paper also that every surgeon throughout his life of the career, they get a 10% of the complications rate. That is a research paper. Okay. If you don't have that much of complications rate, either you are not doing that much of work or there is something wrong. Okay. So the complications is a part of any disease part. So whenever the complication occurs, every doctor goes through the stressful condition.
Exactly.
So what I feel is the patient and the relative should understand that mild complications are bound to happen. Okay, and we as a doctor try to give 100% of us, but still there are complications.
Right.
So to deal with the stress part, so I have been to many, because my patients are very geriatric patients, they are old patients. Mm-hmm. Okay, I have seen the 90s patient and above 90s patients also. I have operated two patients above 96 and nearby 100 age also. So what happens is whenever there is a complications, so we do get a stress. So what I would advise to all doctors also, basically I want to advise all patients, relatives as well as the doctors. As a doctor, stress can be relieved by just reading the articles and updating our knowledge. So that will help us to treat patients more accurately.
Right.
And there will be less complications rate. And I would advise this stress and complication are a part of a doctor's life. Mm-hmm. So as I told you, we should develop at least 1 or 2 extra circular activities so that we are somewhat diverted in a stressful condition.
Right.
So daily doing a workout also, I'm sure, I'm not sure of other field, but most of the orthopedics, they do workout in the morning time. Right. So as a surgeons we do it. So I would advise everyone, just to relieve the stress, we should do regular workout exercises to maintain fit. So fitness will decrease our stress level.
Exactly.
And along with that, I would advise the patients and relate to that they should also understand there are some limitation to our doctors. Though we give 100%,
right.
So sometimes it happens that because of some other old age criteria or some other medical condition, the outcome is not that expected.
Right.
So it should be a hand in hand that all the doctors, relatives, and the patient should be on every same table, so that whatever the complications happen, because we do understand that if the patient suffers, then it's a whole family suffers.
Right.
So they think that they should get relieved as soon as possible.
Exactly. So sir, मेरा एक क्वेश्चन ऐसा है कि जो यंग जनरेशन है वो ऑप्टिंग फॉर MBBS, राइट? सो देयर इज अ लॉट ऑफ कंफ्यूजन, लाइक ये बॉडी कटोर करना पड़ता है या इंसेक्ट से डील करना पड़ता है. सो उनके लिए आप एक फ्यू वर्ड्स उनके लिए.
जो यंग डॉक्टर्स है, दे फील व्हेन आई वाज एंटरिंग, यही मेरा कंफ्यूजन था एंड विद एंजाइटी था कि हाउ आई विल डू इट. But it is every process is like very much planned and everything. So it is not like कि अपने को ऐसा लगता है कि कुछ नया चीज़ कर रहे हैं. And MBBS में we don't do experiment on the animals as such. Okay, we directly मतलब dead body होता है. Okay, we practice on that.
Right.
So it is all very much planned.
Okay.
So initially it's just starting में थोड़ा बहुत ऐसा लगता है, anxiety होता है. But once we are used to it, it is very much enjoyable. मतलब अच्छा रहता है. और when you are learning something from that, it is not like a dead body. It is like some object we are learning in that. So we respect all the bodies, okay, at most care. But initially anxiety होता है. But जो भी young doctors आ रहे हैं, entering हो रहे हैं, nothing to worry. It is very much safe. और जैसा we start on that, the anxiety level बहुत कम हो जाता है.
Right sir. सो मेरा एक क्वेश्चन ऐसा है कि जो एनवायरनमेंट होता है MBBS कॉलेज में, एक PG कॉलेज में, वो कैसा होता है? लाइक सर फुल विल गो थ्रू इट, लाइक एक साथ करेंगे, ऐसा कुछ होता है क्या सर?
Nowadays what happens is MBBS में एंट्री करना इज वेरी tough job actually.
Exactly.
So most of the time ऐसा होता है कि सब जो 12th पास आउट होने के बाद एटलीस्ट 1 or 2 years उसके लिए प्रिपेयर करना पड़ता है. वेरी रेयरली फर्स्ट अटेम्प्ट में किसी को आजकल MBBS मिल रहा है. मिलता है बट वेरी रेयरली. तो क्या होता है कि आफ्टर स्ट्रगलिंग फॉर 2 to 3 years फॉर द एंट्रेंस, व्हेन दे गेट, जब उनको सीट मिलता है, वो इनिशियल 1 year बहुत मतलब एनर्जेटिक रहते हैं. और वो वेरी satisfying लगता है उनको कि after the 2 years of hard work I got this MBBS seat. And the atmosphere is like, वो atmosphere ऐसा रहता है कि we cannot explain it. It's very much satisfactory. और most of the medical college में at least 50 का बैच रहता है, कुछ में 100 रहता है, गवर्नमेंट हॉस्पिटल में around 150 रहता है. We had 100 people. So when जब भी 2 साल के बाद जब हमको मिलता है सीट of the hard work in sense it is almost like 18 hours per day हमको स्टडी करना पड़ता है. दैट मच हार्ड वर्क वी हैव टू डू इट. उसके बाद जब मिलता है ना, तो फर्स्ट 1 year इज़ वेरी सेटिस्फैक्टरी. एंड सो इसके लिए हम सब जो 100 पीपल्स रहते हैं, तो हम साथ में एकदम जो प्रैक्टिकल रहता है हम लोग में, बैचेस, एनाटॉमी लेक्चर्स होते हैं, फर्स्ट ईयर में फिजियोलॉजी लेक्चर्स होते हैं, माइक्रोबायोलॉजी लेक्चर्स होते हैं. सो इट इज़ वेरी मच वो एंजॉय करते हैं हम लोग सब लोग और एक साथ करते हैं. और क्योंकि लिए जिस जो MBBS सीट मिलता है, इट इज़ लाइक ऑल ओवर महाराष्ट्र और समवट आउट ऑफ महाराष्ट्र से भी आते हैं. सो देयर आर वेरी डिफरेंट पीपल, डिफरेंट फ्रॉम डिफरेंट कॉलेजेस, डिफरेंट जो क्राइटेरिया से आए हुए हैं. सो वी आर ऑल डिफरेंट पीपल. सो वहाँ पे सब लोग एक साथ आना और एक दूसरे को पहचानना. सो द फर्स्ट, आई थिंक द फर्स्ट एंड सेकेंड ईयर आर मोस्ट exciting and enjoying part actually.
Okay, so very well answered, sir. Moving to our next question. Describe your most successful medical case to date.
Because I'm practicing since last 10 years, so I think I have many successful cases as such. Though I do have some complication cases also, but satisfying case as such, I can tell you that 2 cases I would like to tell you. One case is like I was deal with the bony part. So there was a lady around 28-year-old, low socio-economic lady, and she has a family with 2 childs. Okay, one was very almost very baby, like one year or so. She was living in the small slum area. So she had fallen from a ladder. So after that she got paralysis from the lower body, complete paralysis. So they have gone to the government hospital. So there was a delay in giving a treatment. So because they were more concerned, so some through my common contacts, they have got my contact. Then they have contacted me. So immediately I have done my MRI, which showed that there is a massive cord compression, spinal cord compression. So in that cases we have to do surgery within around 8 to 12 hours. Otherwise there is permanently she will be paralyzed throughout her life. So immediately I have shifted to the hospital and we have operated within 10 hours or so. Within a week or so she started walking. So that was my I think most successful case, because after, if at the age of 28, if she would have been complete paralysis throughout her life, so that life could have been entirely different with the 2 childs, and there is low socio-economic. So till date also she intermittently she comes over here and she meets me, and always she brings something like sweets or something to me, and she's more, for me it's very satisfying case, because I think I have for a quick surgery I made her to walk. Otherwise it all depends. If the patient I would have delayed, then I would have done nothing, because after 12 hours if you operate also, the recovery chance is very much less. There are many patients who have come after 2 days to me, but that is too late, because there are many cases after 2 days of the cord compression, the recovery is almost nil actually. So that is most successful case, I think so. And second I would comment is on a polio. One of the patient was having a polio leg. So nowadays the polio incidence is very less, though, but there are some individuals which have a polio element. So there was one polio patient who had a fall. After that he had a very crush injury of the hip. He was admitted in some other hospital, and because of the money issue, they were not able to undergo the surgery. So then they contacted me. After that we have approached some other people who can help them.
Yeah.
So after that, we have conducted a surgery. This was a very much complicated surgery. I have a paper of that also.
Okay.
So after the surgery, he started walking. Before how he used to walk,
Mm-hmm.
it was better than that.
Okay.
So he was feeling the polio has also got treated. So I
Okay,
have told him that I have not treated polio as such. We have just made a hip surgery.
Yeah.
So after that, many his contact polio patients have come to me, so saying that something can be done for the polio thing. So I told them that it's just a hip surgery, so it has improved. So these are the two cases which I feel. Apart from there are many cases, but I think these are the two cases which make me satisfied about the surgeries.
Thank you, sir. Sir, we are really grateful to have such doctors in our world.